Thank you so much, Jan, for the nice introduction. Also, Purina Institute, Natalia, Kim, and Mail for supporting us technically and also for the invitation. And yes, as Jan already mentioned, I want to talk about early life stressors and what they can cause later in life. So, about risk factors. I have nothing to disclose. And what I want to talk about is first to give you some background information, some general informations. Then I will talk about mechanisms which are known as risk factors for chronic diseases, like disturbance of the intestinal microbiota and also intestinal barrier function. And then we have already some studies from veterinary medicine showing that an acute intestinal disease can lead to a chronic disease later in life. So first we go to the background informations, and we know from human medicine that the prevalence of food allergies and also immune-mediated diseases are rising, especially in the Western societies. And this has maybe something to do with the lifestyle. We have the same feeling in dogs, but we do not have really good data for this. But what we know is that about 10 to 15% of dogs develop chronic GI signs during their lives. And about 50 to 60% of dogs respond to diet trials only to food. These are not all food allergies, but we believe that there might be some immune components which might develop during life. And another fact is that we see a lot of dogs with progressed disease. As you can see on the right side, a very skinny dog because of small intestinal function, dysfunction, as well as on the left side, a Yorkshire Terrier with ascites due to protein losing enteropathy. And I think it's a general concept that we should be more early in the disease course to diagnose and treat disease so that we maybe could prevent the progression of a disease. And so the general concept of the pathogenesis of chronic enteropathies in dogs is similar to humans, that we believe there is a genetic predisposition. As we have already seen, Yorkshire Terriers, they tend to have protein loss because of dysfunction of the lymphatics. We also see that French bulldogs, boxer dogs, they have sometimes infectious diseases because of immune incompetence. Then there might be some environmental factors. Maybe this is more an important factor in human medicine, but actually we do not know the role of environmental factors in dogs. But deworming, diet, vaccinations, they might also have an influence. But a stronger impact is if you have a really an insult during early life. And that means if we have a severe destruction of the intestinal barrier due to acute enteritis, for example, like in acute hemorrhagic diarrhea syndrome or in parvovirus or in acute Giardia infection, this might cause problems as well as a dysbiosis due to antibiotic usage. And it is believed if we have such an acute event that there might be a dysfunction of the intestinal barrier, which leads to translocation of antigens, bacteria, and this might cause some auto-inflammatory process, some chronic inflammation, which is in the beginning subclinical, but if it's progressing over months to years, there might be an overt chronic enteropathy in these cases. And usually we see our dogs more or less in a very progressed stage or in an end stage sometimes. And today I want really to focus on these early life events. We know that the capacity of our gut microbiome to maintain stable, this is called resilience. And resilience means that there might be some different influences, but still the gut stays healthy. But for the development of this resilience, we need a normal development of the gut microbiota and the intestinal barrier function. And as you can see on this illustration, this needs some time because we are nearly born with a sterile intestinal tract, and it takes some time until we develop a normal intestinal microbiota. And on the other hand, we know that we have a very open intestine, a leaky intestine, because as a newborn, we have to reabsorb the globulins with the colostrum. So that means we have a really an open intestinal mucosa for these huge globulins. But over time, the intestinal barrier function improves and also receives some resilience. This is a very nice review publication showing that early life events can really influence gut health, but also general health. And the problem is that during infancy, the microbiome, as well as the immune system and the barrier function, is very dynamic and vulnerable. So there is not a resilience present at this time. And if you have a significant disturbance like antibiotic exposure and destroying the intestinal microbiota, as well as acute enteritis, destroying the intestinal mucosa and the barrier function, this can really lead to long-term problems like immune-mediated diseases, allergies, and also long-term GI signs. So this is only just some general comments, and now I want to focus a little bit on the intestinal microbiota. We know that the intestinal microbiota plays an important role for the general gut health, but also for energy, metabolism, gut epithelial health, immune function, and also neurobehavioral development, as we heard yesterday. And as you can see on these images, on these pictures, there is really a close relationship between the feces, which consists of more than 50% of bacteria, and the mucosa with the immune system. And with this publication or research in mice, it is nicely shown that the maturation of the immune system is closely related to the intestinal microbiota. For example, we know that mice which are produced sterile and they do not have any bacteria in the intestinal tract, they also do not have a lot of immune cells. And in a normal individuum, we know that most lymphocytes, plasma cells, they are in the intestinal tract. We have more immune cells compared to the bone marrow, to the lymph nodes, to the spleen. And the reason is that we have so many bacteria in the intestinal tract. And in this research project with these mice, they showed in an experimental study that you really need a normal, diverse intestinal microbiota for shaping the immune system. And as you can see here, in a normal system, you nearly have no IgEs. IgEs are antibodies which we have normally if we have an immune reaction, an allergic reaction. So usually in a healthy individuum, we do not want to have a lot of IgEs. On the other hand, IgA is a very important antibody which we need at the mucosal site as a defense. And in a normal individuum, you have not many IgEs, but a lot of IgAs. But if we have a failure to establish a critical level of diversity, then we see that we have a high IgE level in these individuums and still have also a normal or nearly normal IgA level. But in germ-free mice, where we do not have any bacteria, we still have the stimulation or maybe overstimulation of the immune system, so a lot of IgEs, but no defense, so a very small amount of IgA. So this really shows the connection between the intestinal microbiota and the development of the intestinal immune system. And in this review article, it's nicely shown that the development of the intestinal microbiota in human medicine takes some time. We see that there is a lot of changes during the first 12 months, but then we only have minor changes of the intestinal microbiota, although it takes until 5 years. So there might be some small changes in the intestinal microbiome, but usually in human medicine, it's known or it's typical that we reach a normal, diverse and stable microbiome with about 2 to 3 years of life. In veterinary medicine, because also the life is much shorter in dogs, the development is also more rapid. And there is a nice publication also from the research group from Jan. Was published by Amanda Blake, and they showed or they described the postnatal development of the intestinal microbiome. And maybe I can describe a little bit first the dysbiosis index. The dysbiosis index is a PCR-based description of the intestinal microbiome, including 7 different intestinal bacterial taxa. And these are so-called key taxa. That means these are bacterial strains which are present in most or nearly every dog, and they play a very important role. And if you combine the total bacterial number and these 7 bacterial taxa, then you can do a calculation and you receive this dysbiosis index. And if the dysbiosis index is in the negative range, that means this is normal biosis, this is normal. If it's in the positive range, this means dysbiosis. And the dysbiosis index was developed to differentiate between healthy adult dogs and dogs with chronic GI disease. And you can see in the very first weeks in puppies, you have an increased dysbiosis index, which means that we have not a fully complete established intestinal microbiota, but over time, the dysbiosis index goes into the normal range. And one reason or one important intestinal bacterium is Clostridium hieranonis. He is also included in the dysbiosis index. And it is very interesting to see that we are born with a more or less sterile intestinal tract. So we also do not have Clostridium hieranonis. But over the first weeks, we can introduce this bacterial strain into the intestinal tract. And about after 5 to 6 weeks, we can have a normal number of Clostridium hieranonis. And that's very important because Clostridium hieranonis is responsible for converting primary to secondary bile acid. So it's the most important bile acid converter in dogs. And we know that secondary bile acids are also very important to suppress other bacteria, to suppress so-called pathobionts. That means bacteria which might have the potential to have a negative impact on the intestinal tract, for example, like Clostridium difficile. So if we have a normal bile acid conversion, then we see that Clostridium difficile, it's suppressed. And so we have a higher level at the beginning, but with the introduction of hieranonis and a normal bile acid conversion, we see that we have a reduction of this potential toxigenic and dangerous bacterial strain. At the University of Zurich, Switzerland, we have the so-called Growing Dog Project. And the goal of this project is to identify risk factors for chronic diseases in general, or especially for chronic GI diseases. So we want to see dogs very early in the beginning with the age of 8 weeks. And then we want to follow these dogs over the whole life and we do always rechecks where we collect a lot of data and samples. And first results from our study show that dogs have already a nearly normal developed intestinal microbiota by the age of 8 to 12 weeks. So if we look at the dysbiosis index again, we see we have a normal dysbiosis index already in a very early phase in these puppies, and it's stable over the whole first year. And you can see these are the components, the bacteria included in the dysbiosis index, and all are in this reference range where you, or nearly all are in the reference range where you can see indicated with this gray zone. So in dogs, we believe it takes around 4 to 6 months until we have a fully developed intestinal microbiota. But as you can see from this study, is that the key intestinal bacteria are also already stable at an earlier stage with about 8 to 12 weeks. But then we can have some impact on the intestinal microbiota, for example, exposure to antibiotics. And there we have a lot of data from human medicine where we know that antibiotic exposure can really lead to asthma, allergic diseases like rhinitis, dermatitis. It's also associated with obesity and also neurologic diseases. And there are some meta-analyses and review papers in human medicine, as you can see, and for some diseases we have stronger associations and in some weaker. But what we generally know is that really there's an connection between this antibiotic exposure, especially in the early phases of the life, and immune-mediated diseases later on. This is also nicely shown by this very interesting study, which was published in 23, and there they could show that if they followed young babies and infants over the first 5 years of life, and they did physical examinations and frequent rechecks, and then they checked for the development of immune-mediated diseases, and the most important in human medicines is atopic dermatitis, asthma, food allergy, and allergic rhinitis. And they saw that there was a immature maturation of the intestinal microbiota by 1 year if there was an increased risk for these immune-mediated diseases. So we really have some strong evidence from human medicine that we know that antibiotics have an influence on diseases later in life. Now I want to focus on the intestinal barrier function, which is also, beside the intestinal microbiota, very important. And maybe you know, or I want to explain it now, that we have the 3 different mechanisms. One is that we have a luminal defense mechanism, then we have a barrier, which is a physical barrier with these epithelial cells, and then we have the lamina propria with all the immune cells. And first, we want to focus on these luminal defense mechanisms. We know that we want to have a very diverse microbiota, but still have it in a normal range. So we don't want to have a bacterial overgrowth. And to establish a normal commensal bacterial microbiota, we need some substances like biliary juices, gastric acids, pancreatic enzymes. They all keep them in a normal range. They influence the intestinal microbiota, and this normal intestinal microbiota also is important for the development and the structure of the barrier function and the intestinal tract itself. We also know that the normal commensal bacteria, they produce some toxins to influence some other bacteria, which we call pathobionts. We call it pathobionts because they can be present in the normal intestinal tract in a low number, and as long as they are only in a low number, they do not have a negative impact on the gut health or general health. But if we have an overgrowth, for example, of Clostridium perfringens, which is a toxin-producing bacterial strain, then this can be associated with intestinal diseases like hemorrhagic diarrhea or acute diarrhea. But with the normal intestinal microbiota, we have a suppression of the so-called pathobionts. And in addition to these bacteriocins, we also need, as I mentioned before, the bile acids, the conversion from primary to secondary bile acids. We need to have a normal pH in the intestinal tract, and we want to have a normal number of intestinal microbiota which have a competition with the nutrients required by pathogens. For example, if we have an exocrine pancreatic insufficiency, then we know that we have more non-digested nutrients in the intestinal tract, and that means that we have a true bacterial overgrowth in this disease. Another component on the surface of the epithelial lining, there is this mucus layer. And we have a so-called loose outer layer, as you can see here. And in this loose outer layer, we still have some bacteria, which are important for the communication with the immune system. But we also have a very dense inner layer of mucus, and this layer is really devoid of bacteria. So there are no bacteria, and the reason is this is a very dense layer. On the one hand, we have a lot of defense mechanisms like defensins. We have also a lot of IgA in this area. And this is very important that we do not have a direct contact of bacteria and the epithelial lining, because this might mean that we have an increased stress for the immune system. So we want to have a distance between the intestinal microbiota and the epithelium and the immune system, so that we have really a good tolerance. And if there is no mucus layer and bacteria are attaching the epithelial lining, then this means that there might be some stress. And this might be also one explanation why some dogs with chronic GI disease, chronic GI signs, they respond to antibiotics. Sometimes maybe we destroy this bacteria on the surface, and then this might improve improve the immune function and the clinical signs. Besides this mucus layer, underneath this mucus layer, we have this epithelial layer. It's a single layer, and this is different to the skin. We have different areas of cell lines, but this is only a single cell line which is protecting the intestinal tract. And in between the intestinal cells, we have the so-called tight junctions, and these are also very important components so that we do not have macro nutrients or bigger particles translocate between the intestinal cells. And beneath the intestinal epithelium, there lies the lamina propria, which is housing a lot of inflammatory cells, and they're very important in immediately reacting if we have, for example, a translocation of bacteria. But it's also very important, these immune cells, for regulating inflammation and for the oral tolerance. So there is a dual purpose. On the one hand, really these defense mechanisms with these inductive compartments called the gut-associated lymphoid tissue and also the effector compartments with all the cells. But on the other hand, we have a very important function in that we have also tolerating all these bacteria and antigens in the intestinal lumen. And if we have a destruction of this barrier, like we can see on the right side, for example, if you have an acute enteritis, also in chronic diseases, in chronic inflammation, then we have the disruption of the intestinal barrier function, and then this can lead to a translocation of antigens, of bacteria, and this might stimulate the immune system. And also, if this is chronic, this can lead to a chronic immune-mediated GI disease. So these were the most important mechanisms showing what is important to prevent the development of chronic disease. And now I want to switch to the first studies which we have from veterinary medicine. But first I want to show this study from human medicine, because this concept of this study design is the same which we used for our studies in dogs. And in humans, there was an outbreak of a Giardia infection by contamination of drinking water in Norway, and 1,200 patients, humans, were affected by this infection, and they all showed acute intestinal signs. And then a researcher followed this group of patients, and after some years, after 3 years, they asked these patients if they had chronic GI signs later in life, and 48% of these patients, they showed chronic GI signs and so-called irritable bowel syndrome after this acute intestinal Giardia infection. And this was extremely higher, significantly higher compared to the control population. These were also individuals living in the same area, but they did not have this Giardia infection, but they were age and gender matched. And so this really nicely also shows in human medicine that an acute event can lead to a chronic disease. And we had the gut feeling that also in parvovirus enteritis in dogs, this might be the same, because we had the clinical feeling that some dogs which had previously a parvovirus enteritis, they more frequently show chronic GI signs. And there are also mechanisms, maybe which might be associated as a trigger for chronic GI signs, like the barrier dysfunction, because we have this destruction of the intestinal villi in these dogs. We see this bloody diarrhea. We know that most dogs receive antibiotics because they have this combination of immune suppression by neutropenia and barrier dysfunction, which we see as bloody diarrhea. And we know that these are all young dogs, so the timing of the event is also very important. And we performed a study where we selected from our data all the dogs with parvovirus enteritis, and we followed them. And we wanted to know after several years if they developed chronic GI signs. And we also selected a control group which was age and breed matched. And we also sent a questionnaire to the owners of these control dogs. And for us, it was very interesting to see that 42% of dogs developed chronic GI signs later in life. That means they had chronic diarrhea or other GI signs longer as 3 weeks. And this 42% is much higher compared to control group, which only showed chronic GI signs only in 12%. And I was also very happy that the same study or a very similar studies design was performed by a research group in Canada, and they showed similar results. 57% of dogs developed chronic GI signs after an parvovirus enteritis, in comparison only to 25% in the control group. So what we can say is that parvovirus enteritis, if they really have significant GI signs, this is a risk factor for chronic GI signs later in life. Then we have another model in dogs, and this is the canine Giardia enteritis. And again, we have also risk factors in these dogs. We have a barrier dysfunction because we know from human medicine that if you have a Giardia infection, they affect the tight junction between the epithelial cells. We also know that some dogs, they are treated with metronidazole due to the Giardia infection. And again, most dogs which show clinical signs, these are young dogs. And we performed the same study designs that we collected all dogs over a certain time period with the Giardia enteritis. That means all had clinical signs and were positive in the fecal testing for Giardia. And we have a similar pattern compared to the parvovirus enteritis, that about 30% of dog owners responded and mentioned that their dogs developed chronic GI signs during their lives, in comparison to only about 10% in dogs which did not have an acute Giardia infection in the first 9 months. So our interpretation was that there is also a high risk for chronic GI signs after an acute Giardia enteritis. And we also asked the dog owners if they observed chronic skin signs, especially we asked for pruritus. And it was also very interesting in this study group that more than 30% showed chronic pruritus after a Giardia infection, in comparison to less than 10% in the control group. And this leads us a little bit that there might be some immune stimulation during this time of the Giardia infection, of the acute episode, might maybe stimulate the immune system so that we have a development of a chronic GI disease and a chronic skin disease, which means this might be a true allergy maybe in this context. And even more interesting is that we identified by performing a specific statistical testing that especially dogs with severe intestinal damage during the acute phase of the disease, that means we have a high canine acute diarrhea severity index, as we can see here. If we have this severe intestinal destruction, barrier dysfunction, in association with the treatment of metronidazole with antibiotics, then we have even a higher risk to develop chronic GI signs later in life, compared if we have only a mild disease during the acute phase, or if we have only fenbendazole treatment. So that means no antibiotics and no disruption of the intestinal microbiota. And this is very interesting because we have this combination of these two mechanisms, barrier dysfunction as well as dysbiosis. And if we have this combination of these two risk factors, this shows that we have a higher risk for the development of chronic disease. There is another study in cats now, and I wanted also to mention it because I think that's a very interesting study which was presented at the ECVIM Congress, that's the Internal Medicine Congress in Europe. And this was presented as an oral abstract. And in this research project, 104 cats were included, and these 50%, around 50% of these cats, they received antibiotics during the first year of life. And 11% of these cats developed chronic diarrhea late in life. That means after the age of 1 year. And interestingly, 10 of these 11 cats, they received antibiotics. So 90% of cats receiving chronic GI signs, they received antibiotics during childhood or as a young in a young phase as a young cat. And so the interpretation of this research concept was that there is a nearly 20 times more likely the development of developing chronic disease after antibiotic treatment in cats. So I'm already nearly at the end of my presentation, and now I want to start a little bit the discussion and maybe speculate a little bit what we can do during the acute phase of acute enteritis in order to maybe prevent a chronic phase. And what we might consider is that during the acute phase that we want to avoid antigen stimulation, and that means maybe that we have to give in a dog with parvovirus enteritis, we have acute bloody diarrhea. Maybe we could start with parenteral nutrition in context with maybe enteral nutrition with, for example, elemental diets and or hydrolyzed diets. That means that the nutrition components are so small that they are not recognized by the immune system, so that there is no immune stimulation during this acute phase. And usually barrier function should come back very rapidly, maybe after 7 to 10 days. And maybe we have to reduce the antigen stimulation during this acute phase. But this is only speculation, and we know that we need enteral nutrition, but maybe the components have to be small. I think it's self-explaining that we should not do more harm to this in this acute phase. That means we should not give treatments or drugs which might have a negative impact, for example, like proton pump inhibitors, omeprazole, because we know these medications are causing dysbiosis, and they are only indicated if we really have GI bleeding or the suspicion of GI bleeding. We do not want to give anti-inflammatory drugs which belongs to the non-steroidal anti-inflammatory drugs, because we have a less perfect perfusion of the mucosa, so we should avoid this. And also in context to the antimicrobial stewardship, we should really restrict antibiotics to dogs showing systemic inflammation, signs of sepsis. We should not treat dogs with chronic or acute uncomplicated GI disease with antibiotics. We might consider to modulate the intestinal microbiota either with prebiotics, with probiotics, maybe with fecal microbiota transplantation. We know, for example, in dogs with parvoviruses that there's really a positive impact by FMTs in the acute phase. Also, we do not know, but maybe there might be also a positive impact on long term if we restore the intestinal microbiota very rapidly, but this is not known, but we have to perform studies to show this. I think for the future, we really need better strategies to prevent chronic diseases. So that means we need early markers of chronic enteropathies. So to already identify the subclinical stages or early stages, maybe the intestinal dysbiosis might help to identify dysbiosis before we see significant clinical signs. And we also need maybe early markers of intestinal barrier function, which we can use in a routine clinical practice. And this is my last slide, and the takeaways should be that we know that acute intestinal disorders can really lead to long-term consequences, and the mechanisms triggering chronicity, what we believe is barrier dysfunction, especially if we have severe barrier dysfunction, like in hemorrhagic diarrhea, if we see severe intestinal dysbiosis, and especially if this takes place in very young individuals. Thank you so much for your attention, and I'm happy to answer maybe one or two questions or to be present with the discussion at the end of the day.